Hello, I'm Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today we are interviewing Alexis Sams. Welcome.
Hello, good morning or good afternoon where you guys are.
Yeah. Alexis is coming all the way from Arizona, so we had to coordinate this one today.
Yes.
So I want to start by telling you a little bit about Alexis. So Alexis, or Dr. Sams, received her doctorate in physical therapy from Long Island University in 2008. With her degree, she has focused her efforts on providing physical therapy services to athletes and performing artists across the country, including dancers, cheerleaders, musicians, marathon runners, and CrossFit athletes. In 2014, she founded ANS Fitness and Physical Therapy in Arizona, which provides dancers with performance evaluations, fitness and conditioning classes, physical therapy, education and screenings, and technical programs.
Alexis is here today to discuss causes of back pain in dancers. So let's dive right in.
Awesome. Okay, so Alexis, our first question for you. Is back pain common in dancers? And if so, what areas of the back do dancers tend to have the most pain?
Yes, definitely. Back pain is very common in dancers. It's probably my number one complaint from people who come to see me, and it's regardless of age, it's regardless of level, it's regardless of the type of dancing that they do or where they come from. Back pain is definitely high up on the list. More commonly, most dancers complain about middle to lower back pain. Occasionally, I'll get somebody who's got some pain up in between their shoulder blades, but definitely by far, it's low back pain that tends to be the experience of most of the dancers that I end up working with.
So do you find that dancers often come in complaining that they have started having back pain out of the blue, or can they recognize an event that triggered their back pain?
Usually they can't pinpoint a specific episode or a specific event that triggers their pain. Statistically speaking, most performance-related injuries tend to be overuse injuries anyway. So those types of injuries take time. It's usually repetitive activities over weeks or over years. So you've got these dancers that are dancing 3, 4, 5 hours a day, 6 or 7 days a week, and they've been doing it since they were 3. So after a while, the pain starts to kind of build up. And by the time they get to me, it's usually at a point where it's a lot more prevalent throughout their day, and it's just nagging and irritating, and they're done trying to deal with it. So yeah, just to circle back, most times it's creeping up over the years. It's been there for a while. Very rarely do I get a client who comes in and says, my back just started hurting yesterday when I bumped into a wall or when I fell.
Yeah. Wow. Okay. I feel like this is kind of related to overuse maybe, but can being deconditioned cause back pain?
Definitely. Being deconditioned causes back pain. It's probably number one on my list when I'm talking to my clients about why they're having the pain that they have. Usually poor muscle endurance is the cause of a lot of these prolonged or nagging symptoms. Our back muscles, or all of our muscles in general, usually act in two basic ways. They either have a job to do where they have to actively contract and produce motion to the body, or they have to consistently work to hold a position, to hold the body in a certain place so that you can do a given task. A lot of times when dancers are experiencing low back pain, it's usually because they have to hold their back in a certain position. Usually it's just upright. Mm-hmm. And they have to use those muscles to hold that position while they do all these other fabulous things with their bodies, whether they're moving their arms, whether they're kicking their legs to their heads, or, all the things that they do. Their back has to be able to stay kind of stationary and counteract all of that force. Mm-hmm. And sometimes all the tiny little muscles around the back get really tired and tuckered out. And the tired and tuckered out state is where they start to feel the soreness and the pain.
That makes sense. So basically, that's what you were just describing, the poor muscle endurance there.
Yes.
Exactly. So endurance is basically the ability for the muscles, in this case, since that's what we're talking about. It's the ability for the muscles to do their job for an extended period of time.
Right.
Well, for an example, a lot of dancers will come in and they'll say, I start out feeling fine, but by the end of class,
right,
or by the end of the dance, my back is starting to feel sore and achy. Or even if they don't feel it so much in class, they'll feel it at school. I get to school in the beginning of the day and I feel fine, but by the last class, sitting all day, or sometimes even after a couple of minutes of sitting, I start to feel that little soreness and achiness in the lower back. Mm-hmm. Those are signs of poor endurance of the muscles.
So aside from being deconditioned, what other problems can cause back pain?
More frequently, I see a lot of pelvic asymmetries and like muscle imbalances. So we've got muscles, so many muscles that surround our backs and our hips, which is where, most of the problematic muscles are when dancers are dealing with back pain. You've got so many tiny little and big muscles in that area. They all have a job to do. And when I explain it to clients, I say, for the most part, all of those muscles are supposed to be working at 100%. They're supposed to be doing their job. Sometimes you've got a certain group of muscles that are doing their 100%, which is great, but then you've got this other group of muscles that's doing like 75% of the work. That's not cool. So
not carrying load.
What that ends up resulting in is pulling the pelvis or pulling the low back into a different joint position that it should be. And that can relate to difficulty moving the back, difficulty moving the hips, and that can result in different types of pain symptoms. So that's probably the second major cause of back pain that I come across with dancers and other performing artists. The other thing, muscle strength imbalance, but also muscle like restrictions. So some muscles might be tighter to some dancers. They might feel or look tighter than others. And the same thing, they should be strong 100% all doing their job, and they should also be able to move and be flexible to 100% of their capability. So sometimes we see a muscle group that is nice and lengthened and they can do everything that they need to do, and that's great. And then you've got this other group of muscles that's just really tight and doesn't want to move and doesn't want to let go and allow the joints to move properly. And so that imbalance from a mobility perspective or a flexibility perspective can also be problematic. You've also got specific joint restrictions. So any place where two bones come together is what we call a joint. And sometimes the movement at that joint is not optimal. Now, circling back, the joint restriction cannot be optimal because of muscle imbalance or imbalances in flexibility. But sometimes I'll find myself going in and actually working on the actual joint at the actual joint level to get the joint to move a little bit more. And that can help relieve some back pain. And then probably like the last and most rare is actual bony injury. Sometimes, unfortunately, we do have a couple of traumatic episodes, those single episodes where somebody gets hit or somebody falls, unfortunately during a performance or during a routine. That can cause a back injury. Also, hyperflexibility in the spine, especially at a young age, can cause little kind of micro fractures along the vertebrae, along each individual spinal bone. Again, those tend to be a little bit more rare, but it can happen, and those can cause that can lead to different types of pain feelings. So sometimes, after listening to a dancer's story, I take the time to definitely look at them kind of from head to toe. And do a proper examination to try to pinpoint to the best of my ability exactly what is causing, or at least what I think is causing their pain. If I feel like it's a rare occasion where they might have an actual bony injury, we're definitely getting a call to the doctor and getting an x-ray just to make sure that is or isn't the case, and kind of going from there based on those results.
Great. So to clarify, when you're saying pelvic asymmetry, everything you just listed, the muscle imbalances, restriction, the rare possibility of hyperflexibility, that would just be in the location of the pelvic region?
More often in dancers, it ends up being in the pelvic region. Occasionally, I'll have to take some working with the dancer and do some work in the actual spinal area. But more often than not, and if you think about it, it's because that's the part of the body that they're moving a lot of. They're, kicking, they're jumping, they're leaping, they're using their legs and their hip muscles a lot. So more often than not, I'm finding the issues that are causing the back pain, they're usually in the pelvic area, which is the pelvic area ends up being the socket part of the ball and socket joint that makes up your hip. And the way that I explain it to my dancers is, it's kind of weird, but it ends up working most times, is that the pelvis, it's a ring, and it almost looks like two elephant ears. Most people have seen elephants. So they kind of look like two elephant ears, and the fact that they're two separate sides and they connect in the middle by a piece of cartilage. And my point to that is, since they're two separate sides, they can move up and down, they can open and close, and they can kind of spin forward and backwards. They can do those things on their own. They're supposed to move together, and they're supposed to move to the same degree, but a lot of times in the asymmetry, one is moving more or less than the other. And it's a matter of identifying which side is moving more or less, in which direction, and then fixing it.
So it sounds like, first of all, I think you did a really good job explaining some of the possible ways that that back pain can come about. So it sounds like what you've been saying, if I'm hearing you correctly, besides the pelvic asymmetry and the muscle imbalance and even the hyperflexibility, like any kind of deviation from how we should move normally is what can cause pain, with an exception, obviously, of the injury to the bone. Am I hearing you correct and understanding you correctly?
Yeah, for the most part, anything that's out of the ordinary, out of normal, for normal ranges of motion, could be an opportunity to experience pain. And that's kind of what makes what I call functional-based dance conditioning. I've kind of coined my own term. That's what makes functional-based dance conditioning so important, because, being a dancer and being a dancer instructor, we don't do normal things. Like dance, especially where it's going these days, the movements are not normal to the body. So we have to make sure that we account for that by selecting the appropriate exercises at the appropriate amounts to make sure that our bodies are prepared to move in those abnormal positions. So a lot of times you'll hear me say, it's not that I'm against all of, the way that dance is going with these large ranges of motion, for the most part, but these large ranges of motion and increased flexibility. Yes, you need a lot of that way beyond, your normal regular kid going to school who plays soccer or plays piano. Dancers need a lot more than the normal. But with that, there's a responsibility to take care of their bodies in a more than normal type way. And that's kind of the basis of what I do. That's basically the reason why I created my own business, is to be that voice and be that resource for dancers to let them know, hey, you got to do something a little bit more specific, because what you do is so unique and so special, and you really need to make sure that you're working with somebody and treating your body the way that it needs to be treated, so you can do all of those unique and special things.
Absolutely.
Yeah, I think both of us are on board with you. Okay, so we're going to come back to exercise in a second and talking about different ways that dancers should be conditioned to hopefully stave off back pain. But, okay, let's say I'm a dancer and I come in with back pain. How can you kind of walk us through a little bit, an exam to tell us how you might narrow down the cause of the back pain?
Sure. So you're a dancer, you come in and you say you have back pain. The very first thing that I do is listen. I try to find a good balance between not hearing your entire life story, but I do take the time, if you start and say when I was 2, I might say, okay, fast forward until, about 6 months ago. But other than that, I really try to listen intently to what the dancer is telling me. You'll hear me say a lot of tell me in your own words what you're feeling. I'll say, give me as much information as you can about this, usually about their pain. Give me an example of when it hurts you. So sometimes I'll use guiding questions, but a lot of the initial things that I do is just listening to what they're saying, because that often ends up helping me to narrow down what the problem is. in terms of back pain for dancers, I can give a quick example. If they give the example that they're fine at the beginning of class, but throughout class and towards the end of the night, it starts to feel achy and sore. And by the time they're actually in the car getting home, it's really sore and achy, and they just don't feel like moving. That's leaning me in one direction for my exam versus every time I twist, I feel a sharp pinch. Mm-hmm. So being able to listen to what they're saying, listen to the type and the intensity of whatever they're feeling, the condition, like under what circumstances they're feeling it, helps me to guide my exam thereafter. After that, I kind of get a feel for where their pelvis is sitting in terms of looking at that symmetry. Because like I said, 9 times out of 10, what the dancers are complaining about to me usually has to do with some type of imbalance in that area. So I go ahead and look at their pelvis, see if they are having any asymmetry, and I also look at some specific hip and back muscles to assess their strength or their muscle performance, how they kind of do against basic resistance. So that's kind of the next thing that I do. All the time while I'm doing this, I'm letting them know what I'm doing and why I'm doing it. Because I think in terms of building trust, number one, and in terms of building their ability to take care of themselves eventually, they need to understand what's going on. Yep. Dancers love their bodies, but I'm also learning they don't know a lot about them.
Yeah.
And I'm hoping to encourage them to make an investment to learn more about their bodies so that they can take care of them more. So yeah, those are kind of like the top 2 things that I end up doing. I listen first, then I assess the pelvis and the back area, look at strength and the key muscles that most dancers usually are lacking strength in when they're having these complaints. And then we start fixing things, and that's just basically reversing what I found. Mm-hmm. So if one part of or one area of your pelvis is rotated in a certain direction, I work on methods to rotate it the other way. And then we look at it afterwards, see if the symmetry is restored. And if the symmetry is restored, I let them know, hey, we were able to fix it. That's great. I say all the time, you were a really easy fix, and that usually helps them to feel better. Mm-hmm. And then my next thing is, okay, I'm going to give you simple exercises to do so that you hold this new position. Mm-hmm. So then I put the responsibility on them. I guide them, with the appropriate exercises, and I always keep an open door so that if they have questions or their parents or their dance teachers have questions, they can always contact me. But at that point, I let them know that they have a responsibility to maintain the pain-free state that they have achieved with me. Mm-hmm. And that, I'm quickly passing the torch to them to make sure that they take care of themselves. They're the ones out there dancing 20, 25, 30, almost like a part-time, full-time job, mm-hmm. hours worth of dancing. So they need to make sure that they're doing what they're supposed to do. My job is to make sure that I'm giving them the appropriate exercises that work for it.
Right, to become independent. So if there's any dancers here who are listening who might have back pain right now, how will they know when it's a good time to seek out a PT for some checking out to see what's going on back there?
I don't think there's ever a bad time if you're having pain to seek out a PT, at least just to ask. Mm-hmm. And this actually is related to one of my blogs that I have coming up about where I talk about pain is not the problem, but it's a signal that something might be going wrong. I kind of talk about a couple of things that can give you an idea of when it's time to see somebody. Usually the duration of pain. Having, a little ache here and there that lasts for, a couple of hours, a day at most, and it doesn't really come back, is not necessarily always the biggest cause for alarm. However, your pain symptoms that are either coming and going and coming and going and coming and going every time you go to class or every week when you do a certain activity, or pain that is just, it's been a week, it's been 2 weeks, it's been 3 weeks, and it's just not going away. Mm-hmm. Those are usually the times that I tell dancers or their parents or the dance instructors, hey, go ahead and if they're affiliated with me or If they're near me, give me a call. People across the country will shoot me an email or shoot me a Facebook message about their kids or about their own symptoms. Another big one is if they are medicating prior to activity. If you're in the if the dancer or the student is in the habit of taking ibuprofen or taping themselves or doing anything before they go to class because they know they're going to have pain and they're trying to cut it off at the pass, that's a really good reason to go ahead and get checked out and at least talk with a physical therapist.
Awesome. Dancers, are you listening?
Yeah.
Take note. I think that's super important. So basically, when we asked you before, do people tend to have pain out of the blue, or has it been coming on for a while? Those people who you were talking about before, who you said had pain for more than 2 weeks, perhaps should have come to you a little bit earlier.
Right.
Yeah, earlier is always better. But I get it. You know, our community as dancers and artists, we have this kind of like mentality of everybody's expendable. You know, if somebody catches wind that I have pain, I might lose my part.
Yeah.
If I miss a day of class, you know, I might get replaced, or people might think that I'm not as good. So I totally understand and can appreciate the reluctance to seek out care. What I hope with the work that I do is that, at least for me and when I work with my clients, is that people know that even though I'm committed to safety first, which I totally am, safety first, I'm also committed to getting people back to dance quickly because I get it. Like, you want to get back fast. We want to get rid of the pain as soon as possible. We want to fix it, and we want to get you back on your feet. I'm totally on board with that. But we're looking for ways to do it safely. So the earlier somebody comes to me, the better. But if not, I want them to know that I understand the mentality. I understand the dynamics that goes on in the community. I'm actually not completely all about keeping dancers out of dance. So again, I've had discussions with people about what to do when their doctor says, take 3 weeks off, because that's basically like telling a dancer to cut their leg off, you know? And I get that. But 99% of my dancers, even when I'm working with them through an injury, they're still able to dance. They might not be able to do every dance or every single movement to 110%, but at the same time, they're not completely resting for 3 weeks. So I'm always open, and I'm always committed to finding those safe ways that they can still be involved while they're working through their injury. And I'm hoping, or my opinion or my thought is that is why clients come to me. That's why dancers and their parents are coming to me, because they know that my first instinct is to try to keep them dancing if it's safe and if it's appropriate.
Oh, yeah. I think that's a good point. So let's circle back around. I know you started talking about exercise before. I wanted to bring us back.
Yes.
Are there like one or two or a few exercises or activities that a dancer can do to decrease his or her likelihood of getting back pain?
Yes, definitely. There are so many resources out there. So a lot of times I'm all about what fits the dancer's needs and wants best. But within that, my mentality is to try to do things simple. I like keeping things very simple. I like keeping things mobile. So if I don't need to lug around a huge ball or a huge foam roller or 80 billion TheraBands, I'm all about that. Because I'm also about, with my clients, I'm also about no excuses. So if especially if we've resolved a pain issue, if we've gotten them to the point where they're able to return to their dancing at that 100%, I'm looking for activities and exercises to give them that they have no excuse not to do.
Absolutely.
No excuses.
So one of my favorite things to do to reduce pain or to head it off at the pass is just a nice good old-fashioned plank. Now I take them, I do have different versions of them, again going on that functional dance conditioning concept, so I do tweak them a little bit. to make them a little bit more specified and a little bit more appropriate for what dancers do and what dancers need. But at the very basic level, a nice face down plank, or even I think studies have shown that even a side plank does a little bit more of appropriate recruitment of all the spinal muscles to build strength and stability in those muscles to reduce pain. Even if they just start with that, that's better than nothing. I've actually created this little like conditioning on the go card. So if anybody goes to my website, I have this free stuff page, and in the free stuff page, I've got a level 1 and level 2 conditioning card. It's just 4 simple exercises. Again, minimal equipment. I think one of them has a TheraBand. But I call it conditioning on the go because you can literally do them anywhere where your body can fit. If your body can lay down, you can do these exercises. They're not difficult, but they're all excellent ways to either maintain your pain-free state if you had a pain experience, or they're excellent to prevent pain if you're not having any issues and you want to keep it that way. So yeah, my whole mentality with exercise is to keep things simple, to keep things basic, but to also keep them effective.
Nice. We'll have to include that link.
Yeah, definitely.
In this podcast. So if any of you are looking at this podcast, go in the description.
Yes. Thank you so much, Alexis. You've actually answered everything. So we're just going to jump right into the final question, which is, any listener who knows, my favorite question. So please tell us your favorite story of when you have treated a dancer.
My favorite story of treating a dancer was really early on in my career. I hadn't even graduated from physical therapy school yet, and I was working with a professional company, and there was a dancer who became injured, and ironically, that's funny, they injured their back. They
perfect for this.
They were having I didn't even think about it until just a moment ago. They injured their back, and they were having a very sharp pain during a very specific movement in their dance performance, in the choreography. And it was to the point where that the dancer was clearly frustrated. Like, they were in tears. They were so nervous that they weren't going to be able to do the performance. And I was able to participate in the assessment and participate in the treatment approach, which all happened in probably like a 48-hour period is what we're talking about. I was able to participate in the assessment and the treatment approach, and I was also able to sit in with the therapy team, with the choreographers, to kind of brainstorm and troubleshoot any tweaks that we could make in the choreography while keeping the integrity of the choreography and keeping the dancer still able to participate. So that was just all, especially like I said, since I hadn't graduated yet, it was all like so overwhelming and mind-blowing and exciting, and I was like, yes, this is what I want to do. So just to be present and to be able to give not even 2 cents, I gave like a quarter of a cent at that point of my opinion, was just really just an awesome and eye-opening experience. And at the end of it all, the dancer was able to perform. They were able to get through the entire performance. It was a long time ago. I don't remember if they were I believe they were completely pain-free, but if not, they were pretty darn close. Nice. And it was definitely safe. I do remember that. We were able to come to a compromise that allowed the ability for the dancer to participate safely. And then just fast forwarding from that isolated incident, like through the years of my practicing independently, I've just been able to kind of keep that going, which has been awesome. To be able to look at dancers, talk to a choreographer, talk to a dance instructor, and just say, hey, this is what we have going on. You know, what is this piece looking like? I've been able to come in and look at pieces and look at what the dancer's requirements are and just have those conversations and just say, okay, for this week, while they're healing, can they do, I don't know, a one-handed cartwheel instead of an aerial, or can we take that one aerial out because we know that's the only thing that's hurting them, and just being able to have those conversations. So from that one initial story to be able to do it independently as, you know, as an independent clinician and as a business owner has just been very humbling, I guess, over the years, just to, you know, just to feel how impactful you can be on an issue or on an experience that is so meaningful to somebody else has just been awesome.
Yeah. Wow. Thank you for sharing that story.
Yeah.
And thank you, Alexis, for all of your knowledge. And thank you to our listeners for joining us for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more of our episodes, click on the link in the description below to view our website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email us at ptperformanceperspectives@gmail.com.